Thanks so much, and hello and welcome to the final Priority Health Innovation Challenge webinar. My name is Neil Dreimer, and as Director of the CFHI Challenges team, I'm so excited to be joining you today as host for the final webinar. So before we begin, I do want to acknowledge by stating that we're meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that I am joining you and hosting this webinar from Ottawa, which is the traditional and unceded territory of the Algonquin Nation. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. At CFHI, we continue on our learning journey and commitment to support improvement with and for all people in Canada. We, of course, want to thank you and acknowledge everything that you're doing right now in these challenging times. And I'd also encourage you to feel free to use the chat box on the bottom right-hand corner of your screen to tell us who you are and your organization and where you're joining us from. Just a couple of housekeeping notes. As always, we are pleased to host all Priority Health activities, including this webinar, in both official languages. If you wish to listen to our audio in French, please feel free to call in using the number provided in the chat box. And as well, and throughout the webinar, we encourage you to send in your questions using that chat box in either English or French. And we have reserved some time at the end of the webinar for Q&A, but definitely type in your questions as we go. So, what are we talking about today? Well, I think the focus and theme is celebration. You guys have all done it, and congratulations to you all. Today we want to recognize the accomplishments of all of our teams during the Priority Health Innovation Challenge journey. Without sounding too cliche, I think you'll agree that there's never been a more pressing time to innovate, and we want to take a step back and celebrate all you have done while looking forward and beyond. So who's going to be joining us today? Well, I'm so pleased to introduce Dr. Jennifer Zelmer, President and CEO of the Canadian Foundation for Healthcare Improvement, who will be joining us shortly to recognize and celebrate your accomplishments and to announce the overall challenge winners. We're also, and you're in for quite a treat, Dr. James Makokis is our featured speaker today. He will share some of the inspiring lessons, as you continue your innovation journey beyond the challenges, and I'll introduce him a bit more formally later on. So thank you to both Jennifer and Dr. Makokis for joining us today. Also wanted to give a huge shout out to the Challenges team, my colleagues Lindsay, Sabrina, and Emily, who you probably know already if you're one of our teams. You'll find them monitoring the chat box and are your go-to people if you have any questions. Also, a special thank you to our webinar producers and folks who are doing the simultaneous interpretation, who are working behind the scenes to make sure all of our sessions run trouble-free and are as seamless as possible. So just, again, to reiterate, by the end of today's webinar, you'll have a chance to learn about some of the overall results from the great work that our teams did in the Priority Health Challenge. We're going to hear more about the winners of our impact and overall challenge and get to hear from our overall winning team. And finally, Dr. Makokis will be joining us to share some inspiration. So on this map, it's the final map. You can see the 33 teams from across the country who worked collectively on improving access to mental health and home and community care services. And thank you to all. And we also wanted to acknowledge and thank are 20 supporting organizations from across Canada for their support throughout the challenge. The partnerships with our supporting organizations were vital to our program and helped inform and spread the challenge across the country. Many of them presented valuable content at some of our webinars, and we are extremely grateful for their support to amplify the great work that you're doing. As well, on this slide, you can see all of our priority health judges, and we do want to give a warm shout out to them. They reviewed a combined total of over 310 award submissions across the entire program. We recognize that these individuals took time out of their busy schedules to provide you with important feedback and ultimately with the goal of better supporting you and your innovations. And the program would not be a success without them. So once again, thank you to our judges. And once again, this is what the journey looked like. It started back in April 2019, and here we are today. It's amazing how time flies in the middle of a pandemic. We are at the end of the challenge. The pandemic indeed brought upon extraordinary challenges, and again, we want to say thank you for everything that you've done to support the delivery of high-quality healthcare across the country. So with that, we'd now like to formally congratulate the winners of our first award today, which was the Impact Challenge Award. And this award, just a reminder, aimed to capture the overall impact of the project, of your project on patient needs and outcomes. So, drum roll. So our home and community care winners, 3 winners from that stream who will receive $10,000 each are the Alberta Health Services Edmonton Zone team, the Children's Hospital of Eastern Ontario's Family Navigation Project, and CBI Home Health. And the 3 winners for the Mental Health and Addiction stream are Joseph Brand Hospital in Ontario, Calgary Foothills Primary Care Network, and the Sunnybrook Health Science Centre also in Ontario. So once again, congratulations to all of you. And continuing now on the award theme, it's my pleasure to pass it over to Dr. Jennifer Zellmer, President and CEO at CSHI. Jennifer, over to you.
Neil, and let me join Neil in congratulating everyone. And Neil and I are also joining from ish the same place, although as you can tell, not from the same office right now. So I would like to begin by acknowledging that I too am joining today from the traditional unceded territory of the Algonquin Anishinaabe peoples, lands that have been walked by Indigenous peoples since the beginning. And so fortunate that in this new and virtual way, we're able to connect with all of you across the country as well. And so fortunate because this is an opportunity, a fantastic opportunity to congratulate and send our congratulations from the Canadian Foundation for Healthcare Improvement, newly amalgamated with the Canadian Patient Safety Institute. Our joint organization congratulates all of the teams involved for the incredible work that you have done over the course of the challenge. It seems particularly appropriate that we're doing this announcement today, which is the start of Canadian Innovation Week, a week that recognizes innovations of all types across the country. And I mean, boy, it's never been more important to see innovation, to have opportunities for health system resilience. And I know this has been a super challenging time. So I really wanted to recognize and appreciate all of you who are working so hard to respond to needs in your communities, to look at how can we creatively do that in ways that take into account and meet people where they're at right now today, and that will allow us to evolve over time as well. And it's interesting because, you know, the focus of the challenges of the Priority Health Innovation Challenges started in 2017 with all federal, provincial, territorial governments endorsing a common set of principles on shared health priorities that focused on 2 areas. increasing access to mental health and addiction services, and home and community care services, both of which certainly continue to have strong relevance and resonance during the pandemic. And working with the supporting organizations who Neil identified, working with partners across the country, the Priority Health Innovation Challenge, since its launch in April 2019, all of you collectively have reached more than 8,000 individuals, patients, partners, in the ways that your programs have spread out, and I know will continue to reach even more going forward, not just over this 18-month challenge, but well beyond as well. And that included the opportunity to connect with each other, to learn from each other, to share ideas and experiences, to have somebody, when you ran into a stumbling block, pick you up, say, I tried this and it worked, why don't you try that, and come forward together. So a huge thank you as well for everyone who supported each other through this process, through the webinar series, with curriculum webinars, but also through working shoulder to shoulder with each other, with our partners across the country, and all of this during the pandemic. And each of our teams were working in areas that were specific to indicators that had been identified as shared priorities by our governments. And so I wanted to start with a few team result highlights, beginning with mental health and addiction services, where teams were working on issues such as awareness and navigation of services. There were 9 teams working in that area. Many were also working on wait times for mental health services and on waits of repeat emergency department visits and more. And you see on the screen some examples of the types of impact that teams were able to achieve. Reductions in wait times, faster services for people who really needed it, and the ability to access services within a short time frame from the completion of intake as well. Equally, in terms of home and community care, where teams were working in areas such as home care helping recipients to stay at home and reducing caregiver distress, you see some really impressive highlights from teams on the screen, and wanted to take a chance to celebrate not just the impact of the projects directly, but also on behalf of all of those who benefited and who will benefit, both directly through these projects and also through their spread and scale after this challenge, for the work that you've done and really thinking creatively about how it's possible to make health services better. So huge thank you and congratulations to everyone. And now it's time to move to the overall challenge awards. And a grand total of $474,000 was awarded to teams over the course of the Priority Health Innovation Challenge across both streams of activity. And we've seen really incredible work to improve access throughout this period of time. And, if I had the ability to do a formal drum roll, I would do the formal drum roll now. I have to do the virtual drum roll on this front. But let me, without further ado, pass into the challenge winners themselves. So the winners of the $10,000 Booster Awards are listed on your screen in alphabetical order. But I want to hum you a few bars about the work that each of them has been doing. So Body Brave and Eating Disorders Nova Scotia. The Eating Disorders University, their initiative, is a social learning platform designed by and for organizations right across the country that support individuals impacted by eating disorders. Through this platform, those impacted can access educational modules, peer support, workshops, and treatments delivered both by community organizations and treatment providers right across the country. By removing geographic and other barriers to care, because these services may not always be available locally, the e-platform addresses existing inequalities that particularly impact those in rural and underserved areas. Huge congratulations and thank you to our colleagues in Nova Scotia for their work right across Canada. The second team, Calgary Foothills Primary Care Network. Their case collaborative model promotes successful navigation of mental health and addiction services by immediately connecting an individual to the most appropriate services in their community based on their needs. While the model brings together providers from multiple organizations to problem-solve complex patient situations and improve continuity of care as well. So it's really focusing on that full care team and how to best support the individual's served by the network. So thank you to everyone in Calgary for the work that you've been doing. And CBI Home Health has developed the Care for Caregiver program, a 3-tiered program offering varying levels of support for caregivers based on their needs. The program has been initiated for caregivers involved in the Enhanced Palliative Program and Restorative Care Program in the Southwest Local Health Integration Network, with plans to spread next to Erie St. Clair LHIN. So congratulations for the work that you've done already, and a huge shout out for already having plans for what comes next and how you can make sure that even more people benefit from the opportunities that you've developed. Huge thank you to everyone. So moving on to the runners-up. Again, in alphabetical order, although I have to say, Neil, maybe we need to have a conversation after this. My last name begins with Z, so occasionally I like to switch things up. But I'm going to stick with the order on the slide, particularly because I'm a native Edmontonian, so I have to start with Alberta Health Services in the Edmonton Zone. Edmonton Zone's Enhanced Home Living Supports Program aims to ensure caregivers and home care clients with complex chronic conditions have a real choice to remain in their homes and their community. And as well, that caregivers are supported to sustain care and maintain their own well-being. Home care staff educate caregivers and help them access the support they need and navigate health and community systems. And I'm sure all of us in our lives have people who we know of who could really benefit from this type of support and program. So shout out to our colleagues at Alberta Health Services in the Edmonton Zone for the great work that you've been doing. Moving on, great work also at CHEO, very close to where I'm sitting now, in their Family Navigation Program, which supports the social and emotional health of families by helping them access peer support and navigate key services in providing counseling. Parents decide what their goals are and meet with parent navigators or assisting navigators depending on their needs. Approaches used include the feedback-informed treatment approach, which allows clinicians to adjust their treatment approaches based on their client's feedback and to monitor their client's progress. So important as families are facing challenging circumstances to have that kind of support available. And last but not least, our good friends at Joseph Brant. Joseph Brant Hospital has led the development of a multi-agency mental health and addictions model called FAST, or Prioritizing Health Through Acute Stabilization and Transition. FAST is a really innovative, system-wide integrative service delivery model where the goal is to provide the most appropriate urgent mental health and addictions care through timely access, assessment, and intervention while preventing unnecessary emergency department visits and hospital admissions. That's, of course, important all the time, but boy, has that been highlighted as being important through the course of the pandemic in the last few months. So congratulations also to our colleagues at Joseph Brant and to all the teams involved for the successes and results that you've achieved. And I know that everyone would be happy to share more of their experiences if you're interested in following up as well. And then we come to a slide that apparently I'm having a hard time moving to. There we go. Our overall winner of the overall challenge. I'm very pleased to announce it's Sunnybrook Health Sciences Center with their Family Navigation Project. This project is a nonprofit, free of charge service for youth aged 13 to 26 with mental health and addictions concerns. It's designed to guide patients through care plans and reduce barriers to timely access and transition of services. The model aims to reduce barriers to access by creating meaningful relationships with families, to engage them throughout the care process, and in some cases, working with families where youth are not motivated to access care or unwilling to engage in care. And there's some really impressive results that Sunnybrook has achieved, and I'm delighted that we're going to have a chance to hear a little bit more about them in a minute. So congratulations to all of our teams, and congratulations to everybody who's been involved, everyone who's contributed and supported these innovations, and hopefully who will be inspired by this work going forward and the work that needs to be done as we look ahead. So Neil, back to you to go for next steps.
Thanks so much, Jennifer, and once again, congratulations to all of our teams. So it's now my pleasure to hear from, to pass it over to Dr. Anthony Levitt, who is the Family Navigation Project Medical Director from Sunnybrook. So Dr. Levitt, over to you to maybe describe again your project a little bit more and share a few words.
Thank you very much. Can you hear me okay?
We can. Thanks so much. Please go ahead.
Just taking 5 minutes to talk about something I'm so very passionate. It's like handing me a bowl of potato chips and saying, just take one. So I will try and contain my comments to 5 minutes. So yes, the Family Navigation Project is a free service. It's philanthropically funded. It's low barrier, so it's self-referral, and you'll take referrals from youth, from families, from caregivers. And when you say family, it could be siblings, spouse, parent, grandparent, aunt, etc. Now, we respond to people within 1 business day, and this was very important because the program was founded by families for families. And families often tell us they felt that they were in limbo and didn't know whether a call or a letter or a referral had been received. So we respond within a day, and we make an arrangement with a navigator, a clinically trained navigator, to do intensive clinical assessment. A psychiatrist is consulted in all cases, and with the family or the youth, or the family and the youth, we develop a navigation plan, which is designed to connect the youth with and the family to referral sources. And then we follow up to find out, did that referral work, the right referral? Did the provider find the patient appropriate? Did the family and youth find the provider appropriate? And the families asked us to get in the boat, and so no one is discharged from our service. And this recognizes that mental health changes with time, family circumstances change with time, and we try and keep connected. Now, the question is, why is it a family navigation? And for those of you online who are working in family navigation, you'll understand this inherently. But why families? Because the youth often do not recognize having illness, or may not accept care, or may not understand the need for care, or may reject the care from authority figures, or may not express their concerns fully, or may not be motivated. And the family is often the holder of health information. They're often the engine that drives health-seeking behavior. And they are, for a large part, one of the better gauges of the severity and progress. So what we do is multiple things. We are constantly finding and tracking and updating resources. We have a database of over 1,100 different providers and resources across and outside the province. And then we match the youth and the families to the service. The match is the critical part, because often with the youth, you have but one chance to get it right. And if you don't get that first connection right, the youth may not be interested. So the matching is absolutely critical, and we take great lengths to find the match. The other thing we do is to facilitate communication and sometimes unlock the secret language of the healthcare system for families. So often a family will be referred to an organization, will be rejected, have no idea why the referral didn't go through. And it could have been that it was one word on the referral form that was wrong, or they didn't speak to the right person, or they didn't get in the right line. One of the dads we first helped told us that his son was being referred to an agency. It took 9 months to get there. When they got to the front of the line, they were told, you're in the wrong line. But we're pretty sure this next line is the right line for you to go. And they waited in the second line for 3 months and got to the front of that line, and it was the wrong line. And so I guess the catchphrase of Family Navigation Project at the Sunnybrook is no wrong line. We make sure we do work up front so that people are always in the right line and the quickest line. We also help families to articulate their needs to the healthcare professionals. Sometimes families feel on the outside of care and don't know that they can actually communicate. And in fact, healthcare professionals really want to hear from families, but we're in this kind of strange standoff. Families don't think they're allowed to communicate, and often healthcare professionals don't have enough time to communicate with families. And yet when they do make the connection, enormous things are found out, and patients and situations can move forward. We also coordinate care. So when there are multiple service providers, the system does not spontaneously self-organize. And so what we do is we help the different care providers to speak to each other. We don't provide the care, but we do help people to speak to each other. And then the last thing we do is provide feedback to providers and the system. So when the family gives us feedback, we give it to the provider and the system. Since opening in 2013, we've served over 3,600 families, and on average, we navigate to 2.1 people per family, so that's a total of about 7,500 people. We have 10 navigators, 2 intake and admin workers, we have management power, and we have research. The money that we're going to receive from CFHI is going to help us to do a variety of things. Start to plan further engagement of youth. For 85% of our first calls are from family members, and we'd like to see that number, and we love it, and we help families, we'd love to see that number of youth increase. And the second thing is we'd like to explore how our model can help to inform other navigation services or create new navigation services across the province. And so this support will allow us to continue to see the same number of clients received while exploring these 2 issues, youth engagement and extension of the model. That's it for me. Thank you.
No, really appreciate it, Dr. Levitt, and thank you for sharing a little bit more about some of the important things and missing things that I think your program is doing across the healthcare system, and really supporting those families that need the support. And I know we maybe, Dr. Levitt, if you have a chance for one more question, obviously your program is meeting needs of lots of your clients. Can you talk maybe just one thing that you really found to be an important success factor in building your program and getting to the place that you are today?
Yeah, thanks for asking that question. You know, when the families basically came to us and insisted we create something like this, there were 3 features they said. We want you to get in the boat with us. Don't just give us a list and tell us to go on our way. We want you to do matching to the best and to the experts and to the best match for our family. And the third thing they asked us, and this is what I'm going to talk about to answer your question, which is kind of the secret sauce, is compassionate persistence, which is to keep going. Our attitude is there's an answer out there. Even though many families come to us incredibly lost, feeling they have exhausted all opportunities, we believe that there is an answer for each family, and we will persist until we find it, and we do. And the compassionate part is, you know, if we tell you to stop looking and that it's enough, that we've had enough, the families tell us that, we will do that. But until they do, we will persist because we believe that there is an answer for every family.
No, that's, thank you for sharing those reflections, and really, and I'm sure a lot of the people who are listening on the webinar today probably are nodding in agreement. Persistence and really listening to the people that you're trying to support is our key points. So I really want to congratulate you once again, and thank you for sharing. And definitely please keep us in the loop, not just to Sunny, but to all of the teams as to where you are and how you're able to continue your journey after the challenge. So thanks again, Dr. Levitt, and really appreciate those words.